The FDA, they've issued a Dear Veterinarian letter. This is something you should know about. They're saying there's a large reported number of adverse events, i.e. side effects, of dogs are being treated with this new anti-arthritic drug, Librela.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
I'm having a brand new webinar that I think you're really going to want to go to. Everything you need to know about dog nutrition. Like, is this food that you're feeding your dog, is it even safe? What about the bird flu being found in pet food? The common veterinary medicines, can these hurt my dog? In this free webinar, I'm going to be showing you the best food to feed, what not, including my top natural remedies so you can avoid conventional drug reactions. The webinar is free. It's happening Tuesday, January 21st at 5 p.m. Pacific. You can click the link in the box below to sign up. This is the so-called wonder drug you should be cautious of. So the FDA, they recently sent out a bunch of Dear Veterinarian letters. And in the envelope, you open it up and what do you see? Dear Veterinarian, the FDA, they've issued a new report of adverse events in dogs treated with Librela. The monoclonal antibody drug is used for the control of pain associated with osteoarthritis in dogs. So what is this new drug, Librela? It's a monoclonal antibody drug that was recently approved by the FDA specifically for managing osteoarthritis in dogs. It was fast-tracked with limited preclinical studies. It was approved May 2023. Many dogs, they've responded really well. But at the same time, there has been a host of reported side effects. As of April 2024, there's over 4,000 reported serious adverse events. And in the letter, they state some of these adverse events. Neurologic signs such as ataxia or wobbling, seizures, paresis or paralysis, even full recumbency, unable to move. Other serious clinical signs, urinary incontinence, they're dribbling urine, increased thirst, increased excessive urination. Then in some cases, as it says in the letter, believe it or not, they're seeing some of these dogs actually died. Some are being euthanized because of like the serious side effects, because of what kind of damage this drug had done. And disturbingly, most of these serious adverse events, these serious side effects, they occur within the first week of administration. The drug itself, Librela, it's meant to be a once-a-month injection just given to your dog under the skin. And they're saying like for most of the dogs having these serious side effects, I mean, it happened within a short period of time, a week after giving that first injection. So meaning there's no real way to know, like you're thinking it was fine with my neighbor's dog, my dog should be fine, right? No. That's no guarantee, and that's not the case, and that's what's been so many people's experience. In the letter, the FDA is saying they're kind of offer reassurance. They say they emphasize their ongoing efforts to monitor the safety of veterinary drugs once they're available in the market. But there's a caveat. While pre-approval testing assesses safety and efficacy, widespread use can sometimes reveal issues that were not previously identified. And then what I find really disconcerting is they conclude by saying the FDA currently lacks the authority to mandate safety-related labeling changes. What? Meaning they can't force the company Zoetis, which manufactures and is making millions of dollars off this injectable drug, to put a warning on here. Warning! Serious adverse events, neurologic disease, urinary incontinence, seizures, coma, ataxia, maybe even death. You know, isn't that something you'd want to know about before you're going to go ahead and ask your veterinarian? Yep, sure. My dog's been limping. I've tried a couple things. It hasn't worked. Just give him this monthly injection and, you know, it looks good on the label. No side effects, right? Maybe not. That's not so. Maybe that's not the case. And of course, you should be aware of that. So knowing all this, what do I think you should do? Well, number one, and first and foremost, be really cautious if you're even considering having your veterinarian inject your dog with this drug, Librela. Try many of the alternatives first. If nothing else works, then maybe consider it. But be fully aware that there's a chance of a serious side effect, and it may be that there's nothing you can do about it. Ensure your dog's been on a good quality joint support supplement, one that includes glucosamine, chondroitin, MSM, kind of like our Ultimate Canine Advance. A good quality omega-3 fatty acid, such as our krill oil. An effective natural painkiller, like Dr. Jones's Ultimate CBD for dogs and cats. Weight management. Just make sure your dog isn't overweight, that he's not putting undue stress on his joints. Maybe you need to be feeding him less. Maybe you need to look at some form of calorie-reduced diet, specifically one that is high protein, low carbohydrate. Getting your dog more gradual, gentle exercise if you can make such a big difference. Number one, you're going to help them lose weight. Number two, just the gradual movement itself, just flexing and extending that joints, that's going to produce joint fluid. That's going to provide natural pain relief. Some of the zero side effect touch therapies. An easiest one for you guys to consider is just acupressure. In acupressure, you're just putting your fingers over top of key acupuncture points. I've got a bunch of videos on this on YouTube. We're going to link to it. And I'll show you one in particular. It's called the aspirin joint. It's in between this webbing of skin in behind your dog's Achilles tendon, right? So we're right above your dog's hock. My thumb on the outside, my index fingers on the inside. I'm going to hold that for 30 to 60 seconds. I'm going to be doing that twice a day. Do that for your week and your dog. You may actually see that it's actually being beneficial and helpful without any side effects. This one acupressure point here in between your dog's eyes at the base of his nose, bridge of his nose. If you hold that, it's called the yin tang point. You can hold that for 30 to 60 seconds and it works so well for anxiety. So as you can see, little Tula, she gets so much calmer when I press on the yin tang point. So yeah, acupressure is a real thing and it can really benefit your dog. When the FDA, they issue a Dear Veterinarian letter to vets, this is something you should be aware of. That means there's been a bunch of big side effects. I just want to ensure that this never happens to your dog. Thank you so much for watching this edition of Veterinary Secrets of the Dear Veterinarian letter from the FDA about this drug Librela and the serious increase in number of side effects. Click up there to subscribe, hit the bell to sign up for notifications. Then last but not least, I encourage you to sign up for a brand new webinar. Are you really feeding your dog right? Discover the truth about dog nutrition. We're going to be covering the mystery dog illness. We're going to be covering DCM and diet. Bird flu, is it actually in our pet's food? I'm going to show you vet-approved recipes. What you need to know about meal toppers for dogs. How to safely feed organ meats. Plus my top natural remedies to the most common dog diseases, specifically dog arthritis. We're going to cover dog cancer. We're going to even cover allergies. The webinar is happening Tuesday, January 21st at 5 p.m. Pacific. You can click the link in the box below to sign up.